store for the back half of your work week? Chief Meteorologist Eric Thomas back with us in a bit to talk weather. Right now, though, on Bounce, the folks at Charlotte Plastic Surgery are welcoming a new doctor to the Queen City. We have Dr. Nyame here to talk about a subject that can be a little touchy for some of us, plastic surgery. But he also wants to provide some advice about skin care treatments, particularly for folks of color. So thank you for being here today, Dr. Nyame.
Thanks for having me.
And welcome to the Queen City.
I love being here.
I'm glad to hear that. I'm a native, so I always want to hear that our city is treating folks well.
Phenomenal.
We are going to talk about your skincare recommendations in just a moment. But first, I want to sort of give folks a backstory and talk about your success as a doctor and where you hoped your dream would take you.
Thank you. You know, I was born in a small village in Ghana, West Africa, and as I look at the progression of my life, I could have never imagined I would have gotten this far. I was fortunate enough to come to the United States with my older brother. Had hardworking parents who instilled the values of a good education and hard work. I was able to get to Cornell University, where I graduated with honors. And then following that, attended Harvard Medical School, where I also graduated top of my class. Following Harvard, I started my plastic surgery training at Harvard, where I was fortunate enough to be involved in a number of groundbreaking procedures in the United States.
Awesome. I mean, gosh, what have you been doing with your life? I mean, you just clearly have been knocking it out of the park from day one. But you're not one to leave Ghana and never look back. Let's talk about what you're doing to change the lives of people in your native country.
Thank you. You know, my brother and I, my brother's now a neurosurgeon, and I'm a plastic surgeon. We've been very fortunate to have come out of this.
Clearly a family of underachievers. I mean, wow. I'm sorry, continue.
Given our success, what our hopes are long term is to be able to go back to Ghana and set up a medical mission in order to take care of the underprivileged and people who would benefit from advances that we have benefited from. And goals of doing this, I've now been back on 2 medical missions to work in both my home village, which is slowly improving with new paved roads and water and a lot of other infrastructural projects. But beyond this, I'm hoping to teach plastic surgery and some of the techniques that I've learned here to residents and trainees in Ghana, where they're lacking a lot of the innovative techniques that has made plastic surgery in the United States such a leading field when it comes to plastic surgery throughout the world.
Paying it forward. You talked about all of the groundbreaking procedures that you've been a part of. Specifically, you were on the team that performed the first full-face transplant.
You know, I've been incredibly privileged. At the Brigham and Women's Hospital, which is where I did most of my training, we have been leading the way for facial transplantation as well as hand transplantation. So out of the 7 full-face transplants, I've been privileged to be a part of 5 out of the 7, as well as 2 bilateral hands. That's been led by the efforts of Dr. Pomahawk, Dr. Matthew Carty, and most of the team at the Brigham and Women's Hospital. Having come to the Queen City, I hope to make the institution that has made me the plastic surgeon that I am, proud.
Well, their loss is our gain for sure. You also specialize in aesthetic breast surgery.
Correct.
And I want to talk about this recent article that says millennials, young adults, are getting more and more plastic surgery these days. What's the driving force behind that trend? You
know, as social media has increased among millennials and among other patients, people are more aware of the differences among each other. For example, many patients who may be newly out of college and attending a reunion may see other classmates on social media. And then to get ready for these reunions, they may want to look their best. That has driven an increase in both facial aesthetic surgery, breast aesthetic surgery, and a lot of the simpler things, even non-surgical maneuvers such as fillers, Botox, and most importantly, skincare.
So what do you see most coming into your office request for? If there was like a top 3, what would you say?
I think the top 3, and this is validated by the American Society of Plastic Surgery statistics, would be breast augmentation for surgical procedures. A lot of younger women are looking to enhance their own image with breast augmentation simply because the procedure is tried, tested, and safe. Okay. When it comes to the generation between the 30s and 40s, things that are non-injectables, non-surgical, such as injectables, are actually very common. And then in the older generation, facelifts and eyelid lifts to rejuvenate. But a huge portion of the plastic surgery market, of the 15.9 billion procedures done last year, is actually non-surgical procedures, and that would be fillers, Botox, and a number of other non-surgical procedures.
So for the folks who aren't keen on the knife and aren't keen on fillers, I just botulism into my forehead. I have a hard time wrapping my brain around that. Skincare is the next best option, I guess, if you would say. So let's talk about your recommendations.
You know, skincare is one of the most important facets of how we present ourselves to the world. Our skin is what most people see when they interact with us, and it's very important for that to be a representation of how healthy we are otherwise. The average woman will spend about $1,000 a year on skincare products. Unfortunately, most of these products have no legitimate data behind them. But the industry is aware that people will buy products just based on how the bottle looks and a number of other things that don't really matter. So here at Charlotte Plastic Surgery, we've been able to distill the products that have good scientific evidence behind them. And I have a few of those products listed here.
Let's start from this end, shall we? Or whatever end you think is best.
Start from this end.
Okay.
This is a Tns Central Repair. This product here has over 110 growth factors that are meant to restore a lot of the growth factors that our body's missing as time moves on. In addition to that, it has antioxidants that are able to counteract a lot of the toxins that damage the skin and decrease the amount of collagen we have.
Okay. And this is a skin brightening complex.
Now, this is a skin brightening complex that is actually very effective, especially in skin of color like your skin and my skin. Because skin of color has a lot of melanin, there are oftentimes different areas where pigments can cause blemishes. These blemishes show up as dark spots. By using a product like this, which brightens and lightens and evens the tone in patients with skin of color and patients and on all other skin types, this is one of the critical agents that's been almost incredible as far as alleviating a lot of the dark spots that tend to show up, especially in skin
that
color.
hyperpigmentation.
Exactly.
Okay. And this is a rejuvenating hydration in layman's terms. What does that mean?
This is one of the most phenomenal products on the market currently. So this product has 5 different types of high-grade hyaluronic acid.
Okay, I'm familiar.
Hyaluronic acid is a substance that your body makes, and it holds on to water. By holding on to water, it smoothens the skin, hydrates your skin, and plumps it up. By plumping it up, a lot of those fine lines and wrinkles, that crepey skin around the eyelids, can essentially be eradicated. This product is new on the market, and it's flying off the shelves.
All right, and lastly, we have, you know, I think most people know your moisturizer needs to have sunscreen in it.
That's correct. That's correct. And one of the biggest myths, especially in skin of color, is that because we have melanin, we don't need it. And that is couldn't be further from the truth. I use a sunscreen every day.
Yeah.
And my patients are amazed to hear this because they would assume I don't need it. This product is combined with a defense repair mechanism that rejuvenates and restores skin to its quality while adding that sunscreen. And that helps prevent a lot of the damages from UV radiation that we know the sun causes.
So melanin can be a plus, but it's not a get out of jail free card.
Exactly.
You still got to do the work.
Exactly.
And I'm just going to keep it real. You know, I know you say people are willing to pay, but you get what you pay for. And so this is not going to be like some of the popular brands price point wise that you would see in Wally, Target, drugstore.
Certainly this is on the higher end of the market, but completely worth it. Despite the price point, this is one of the best-selling lines. Like I said before, the average woman will spend over $1,000 a year on products. Most of those products do not work.
All right. Wowza. This has been super informative. Like, I mean, just really. So, did you bring a swag bag? Just, I'm kidding. Sort of. Okay, so Dr. Theo Nyame, thank you so much for being here, and welcome again to the Queen City.
Thank you so much. Really appreciate you having me.
For more information, log on to WBTV.com. We've got all the information you need in the web extra section of the home tab. We'll have to have you back again to talk skincare.
Perfect.